Marie's 58-year battle with diabetes may have claimed her sight, but not her spirit. Today she's one of the patients seeing her physician, Dr. Frank Egan, in a group medical visit.
I developed diabetes when I was 2 years old, and here I still am. One day the one eye just completely went black, but I still wasn't telling anybody. Finally one day I walked into a door jam, and I guess it just completely all just went black.
Patients with chronic disease often feel isolated and alone, finding it difficult to get enough information and support in a one-on-one appointment with their doctor. The group medical visits approach has proven to be empowering for many patients. In group medical visits, patients can learn, ask questions, share knowledge, and gain confidence in their ability to self-manage their chronic disease.
I'd like just to go through what some of the stuff that we did on the first visit. And first is just to acknowledge that there's confidentiality, understanding.
Physicians can help improve care for patients with chronic conditions by providing information, advice, and hands-on care. There are 3 common models of group medical visits. Here in Victoria, Dr. Frank Egan is conducting a monthly group visit. This model is known as a Cooperative Healthcare Clinic model, CHCC. The same group of patients with similar conditions, in this case diabetes, is regularly scheduled for a specific number of visits.
The personal health record, which is a very nice little booklet that has a lot of
Dr. Egan leads the group discussion, providing self-management education. He also explains blood results and refills prescriptions. Group medical visits may also include educational sessions on specific topics. These sessions are generally led by the physician or other medical professionals, such as dietitians, behaviorists, or diabetes nurses. Dr. Egan's MOA does one-on-one care, and she has high praise for group medical visits.
I think they're great, and I know the patients really enjoy them, and it's not a lot of work at all.
Oh, for me they're good. It's good for me to talk with other people that are just learning about this disease and how you can improve it.
A little bit frightening to start with. However, when we settle into our group, all the patients really settle in. You're holding your own. Not quite a target, some work to go, but you're really doing, I think you're doing well. You don't have to be an extraordinary doctor, you don't have to have an extraordinary office. You just need to have the spirit, the willingness, an open mind, and be willing to jump into the deep end and see what happens. It's actually, when you get into it, it's enjoyable, it's very professionally satisfying.
A second model of group medical visits is called a DIGMA, a drop-in group medical appointment. That is, a regularly scheduled event, but not necessarily with the same group of patients. At his office in Fraser Lake, Dr. John Polovich runs a DIGMA-style group with patients who have different medical conditions. The nurse, physician, MOA, and behaviorist work together as a team. For the first part of the visit, they handle simple problems and collect individual patient assessments.
So we might be taking some blood pressures, checking on blood work and that kind of thing.
Then Dr. Polovich comes in and does individual patient consultations in the group context.
Wilma, how you been feeling?
I'm doing great.
Are you?
I feel well now.
So is it okay if I tell people what happened?
You can.
I can? Okay. So Wilma came a few weeks back into the emergency room, and her heart was beating very, very fast, almost 200 beats per minute.
Okay.
The group discussion enhances the learning of the entire group.
And it works good. You learn things here, even questions you don't even think to ask. If you don't ask it, somebody else does, and so you get a lot of information that you might not otherwise get in your usual 10-minute appointment.
What I like about groups is that people have an opportunity to learn from each other as well as from a team.
So unlike my traditional office, like in here, where we see patients one at a time in that traditional model, I don't have any data actually really to support whether that's good or bad. It's kind of the way doctors have traditionally practiced. but it's really not substantiated by any good evidence of patient satisfaction. Whereas my group visits are strongly endorsed and followed by good evidence on a weekly basis. Ideally, his blood pressure should be less than 140/90. Both systems are meant to be complementary to each other, so it's not meant to be one is better than the other. They're meant to complement each other, meant to provide more choice for patients, better access overall, and better enjoyment for me. So I think it's a win-win all around.
A third example of group medical visits is called a shared medical appointment.
So, do you mind talking about your birth experience with us?
Sure.
Here in Prince George, Dr. Paul Murray holds a weekly prenatal appointment for 8 to 12 pregnant women who attend along with their support person.
They said that it was probably because I may have flexed while they were doing it.
Oh, so don't
but
flex.
It's really hard when you're having a contraction not to flex.
Patients have their one-on-one private physical with Dr. Murray, while public health nurse Natasha Thorne facilitates the group, fielding questions and asking others how they dealt with similar situations. All patients receive a physical exam in private, but questions are answered within the group setting following the physicals. Once Dr. Murray has completed the physical exams, he joins the group to respond to questions. The women are asked to defer their questions until they're back in the group.
So the second one was pain medications in labor. What are the options? And more specifically, what are the epidural complications that can occur?
So the pain in labor, there are three things that we talk about that are not involving medications. So the first thing is going to...
The normal physical usually takes 30 to 45 minutes. In a group medical visit, lasting an hour and a half to 2 hours, the doctor can see 6 to 10 patients for the physical and answer all of their questions. In a one-on-one appointment, a doctor can only complete 4 to 6 physicals in the same time. Avoiding repetition shortens the overall appointment.
The reason I like doing them is because it's a very enjoyable part of my practice. The patients like them. They gain from each other, and they also gain from the fact that if somebody asks a question, everybody else hears the answer. So it's a very efficient way of delivering advice and care.
This is the best part of my job, I say. Yeah, I love it. It's great. I have gotten to know these girls so well. It's very hard for me when they have to leave and they have their babies and I don't get to see them, so I love it.
The thing is that the questions that are answered and asked, they just prompt more questions and more discussion, and they're funny. You hear funny stories.
Yeah.
And
Not only that, you don't feel so self-conscious about the things that you may be experiencing. You're like, oh, you have that too?
Although the physical limitations of medical offices can present challenges for any type of group medical visit, there's great return on investment in this concept. For patients, doctors, and medical staff, the bottom line is group medical visits work.
From a nurse perspective, I'd say it's between an 8 and a 10 somewhere.
The group visits are certainly, they're a new dimension to general practice. They add an extra interest, and they're certainly well appreciated by your patients.
It gives you a better understanding and maybe gives you some goals to see that you can still improve yourself.